Welcome to Adapted Plus. If you're struggling with fundamentals, you are not alone. I'm making this video in order to help out based on popular requests and questions I've heard from other people taking the exams. This is a comprehensive. I try to make it as much as possible. Stick around, and I think this should be your companion. You would love to watch this video. The questions get harder and harder as you progress, so you should stick around and go and look at all the 85 questions. You can watch them in segment, but you get harder as we progress. Concept, you have to know, straightforward concept. That's all. First question. If you've never seen this instrument before, well, here you go. They can ask you a question on it. It's a concept. Nobody can teach you except you knowing the fact. Which port, one word, should the nurse use? A nurse need to measure a client with central venous pressure to assess fluid status. So which of these should the client use to measure that? Straightforward, right? Like I say, it's concept. This is what we call a triple lumen. It's a central venous catheter, okay? You go into the SVC, right? And this is the tip of it. There's different, there's a blue color, there's a white or gray, whatever you want to call it, and there's a brown or red, right? Whichever you want, brown or red. This is the distal port. The distal port is always where you can use it to measure your CVP. The middle port, this is where you go to with the TPN. It's usually the medial port of it. It's out of the tissue, so that's why you don't use the other ones. This is out of the tissue and it's in the middle. This is usually the red port is used for blood draw, and it's the proximal one. So concept, like you said, the blue port is always used for central venous pressure, and it's the distal port. Whatever they tell you is the distal port, yeah. So this is the blue port, and that's what you use for central venous pressure. That's all. Concept. One down. Number two, same thing, right? What is the nurse best action? Your best action. A nurse is caring for a client who pulled the NG tube and now vomiting continuously. There's taking strategy as we go through. I would show you how to answer questions. I've always underline the keywords, which are called the buzzwords, and focus on it. Pull the NG tube, and what is happening to the patient? Vomiting continuously. You have no time. What is your number one priority for this patient who is vomiting? Airway, right? Airway. Assessing the airway is not going to help you. You want to protect the airway at this time. Calling the MD is not going to help you at this time. If you put the patient on the left lateral position, yeah, you're preventing airway compromise. That is aspiration. You can put them in oxygen you want, but so far as they are in that position, in the no anything less than the lateral position, you're putting them at risk for aspiration. So my best option is to put them in the lateral position, put in oxygen on, assess the airway, and call the doctor. So that's what I would do. This position is the best one to prevent aspiration. Number three, same strategy. Which action should the nurse take first? An action to take first. A nurse is caring for a client who is complaining of what? Shortness of breath and anxious. Okay, I'm complaining of what? Shortness of breath and anxiety. Anxious, that means anger, right? What do you want to do? Do you want to put the oxygen on them? Call the MED, assess the airway, and elevate the bed. The patient is symptomatic from dyspnea. He has shortness of breath and anxiety. What is your first thing you want to do? To me, when anybody who is in respiratory distress, okay, respiratory distress, and they ask me the first thing to do, I'll always take position over oxygen. Okay, It's the first thing to do. I will take position over oxygen. And therefore, I will place this patient out of the bed before I place the oxygen, and then assess the airway and call the doctor. But if they ask me for the best position, for the best action, what is your, if the question is what action should what is the next best action? Oxygen is better, because if you lay down and you put on oxygen in, you'll be fine, right? I'd rather put the oxygen when he was laying down rather than sitting up. That is your best option. But when he said first action, elevate the head. So position is much better when he asks you for the first position. So elevate the head out of the bed. So I would take that one over placing them on oxygen. That's the easiest thing you can do. So elevate, elevate, elevate. Number 4 is your right answer. Question 4. Which of the following the nurse should include? A nurse is teaching new graduate on factors that forcefully elevate what? SaO2. That means your saturation. Keywords, that's all. SaO2 forcefully elevated. What are the things that will increase your saturation? That's all. That's what the question is asking you, right? Forcefully elevated. Patients who are anemic is one of them. Their saturation is forcefully elevated, so I don't depend on. They may be anemic, but it's because the body is looking for every tiny oxygen. So that's why they usually forcefully elevated. If you give them a contrast, it's going to affect how the light go through the blood. So it's going to be elevated. Nail polish, usually, then what it does is it decreases your saturation level. So it does not elevate it. Carbon monoxide poisoning. When you're exposed to carbon monoxide, your saturation is forcefully elevated. Higher altitude does not affect it. This just affects your hemoglobin. So what are the things that can forcefully elevate your saturation? Anemia at the CT scan within the next 2 days with contrast, and then carbon monoxide poisoning. That's the key. Like I told you, concept. We're going to be talking about concept throughout these cases, and then you can write it down, pause the video, watch what I'm doing, answer your question, see what I say. If you don't agree, you can send me an email. But that is the way I want you to attack these questions. And this is caring for 4 clients. Which client need to be placed in what? Neutropenic precaution. All these questions, I just underline the buzzword and I focus on it. Test taking strategy. What is neutropenic precaution? That's what the question is asking you. That means, what should you worry about in a patient who has neutropenic precaution? What are the diagnoses of neutropenic precaution? Absolute neutrophil count, if it's less than 500, yeah, you're sick. ANC, we call it. Client with CD4 count less than 4, less than 200, is immunocompromised. If you have white count less than 5,000, you get into agranulocytosis range. Your platelet has nothing to do with neutropenic precaution. If your WBC is less than 10,000, it's fine because it's between 5,000 to 10,000. So if it's less, yeah. If it's when it's less than 5,000, it becomes a problem. So 1, 2, 3 is a problem. This guy, you don't need to put in neutropenic precaution. It's just a test-taking strategy. All these questions, that's what I desire, my desire to show you. What is the next best action? What is your best action? And this is caring for a terminally ill client on hospice who die on hospice ward. The client has what? Fentanyl patch in place, right? He has fentanyl patch in place. What is the next best action? All it means is this is the patient. He has a patch in place, and he's dead. What do you want to do? Straightforward question. You call the pharmacy to come and remove it? I asked them how to dispose it. You should know by now. You call the family to remove it. That's not their job. Remove the patch and dispose it by protocol. This is better. Notify the morgue about what? Location of the patch. They don't care about it. The guy does not need autopsy or anything like that. He just dead. He's an hospice. No, nothing. The question asking you whether they're going to do autopsy. So treat it the way it is. Remove it and do your job. That's the number 3 is the right answer. Number 7. After teaching newborn mother, it's a newborn mother, about infant car seat, which of the following statement by the mother indicate the need for further teaching? The concept, car seat. If you don't know about it, read about it. Everything that underline, if you don't know, just take a note and say, oh, I need to know more about car seat. What is the strategy? What is the concept? Rear facing car seat until you're 2 years old. That's the standard. After 2 years to 5 years, you can do forward facing, but you're still in the car seat, okay? Keep at 90 degrees while sitting in the car seat. No, when the kid head is straight like that, it's the problem. You want to give them 45 degrees. 45 degrees like that. If you keep them this, they're going to aspirate, okay? Or airway compromise. They will have airway choking. They will choke on themselves. So putting them on at least 45 degrees, 90 degrees is too much. They have to be in the booster seat, okay? They don't like it, but good luck with that. You have to be in the booster seat for a couple of years before you can move out of it. So yeah, stay in the booster seat as long as you, until you reach a certain age, okay? 4 to 12 years old. That's how long you got to be like in the booster seat. So 5 years, good luck. So this is the right. That's the question asks, need further teaching. So 3 need further teaching. The baby should be like 45 degrees. So if you don't know, check CASET and the concept you need to know. This is also poisoning. What should the nurse tell the mother? The mother called the nurse hotline after she saw a 2-year-old child emptied the whole bottle of a cleansing agent in the mouth. You just drink some poison. That's all. Rewrite the question your own. Kate drank some poison. What do you do? The mother is on the line. What do you want to do? There's a concept. If the patient has symptoms, they call 911. If there is no symptoms, you call poison control. But how do you know symptoms? You got to ask. So I'm not calling you. I'm not calling you. Number 3 is negative. Why we don't use this? We used to use this. Every question about poison control, trust me, there's going to be this epica of syrup because it's common. Everybody have it and they try to use it. No. The reason why we don't use it, you cause more damage when things are coming out. So when induced vomiting and it's coming out, there's more damage than let the kid swallow whatever poison is going on. So access for symptom is your key. Let's take in strategy, adapt NCLEX way. Number 9, what do we have? What is the nurse first action? First thing you should do. A nurse saw a fire in the client room, bathroom when administering medication. What is the nurse first action? Concept, concept, concept. And what is the concept? Raise. Rescue them, okay? Rescue, 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 rescue. And then put the alarm on, contain the fire, evacuate, and then extinguish the fire. Which answer choice? Showing rescue, closing the door is not enough, alerting the fire system is not enough, remove the client from the area. Is that immediate danger? Per the raise formula. That's big. Before you evacuate others. Clients near the fire need to be safe. Let's take in strategy. Number 10. Select or apply. Which of the following actions are appropriate? A nurse saw a fire coming out from the kitchen on the ward. Now he saw the fire coming out of the kitchen in the ward. What do you do? Secure. What is he supposed to do? Secure and keep non-ambulatory. People who are not working clients in their room. You should not secure them because Ray said what? Evacuate. Okay? Nobody gets secure in the room. Even if you don't work in, we're getting you out of there. Ask ambulatory client to move to a safe place. Yeah. If you can walk, go to a safe place. Close all doors on the ward. Yeah. Contain it. Notify fire team about the location of the fire. That's the alarm. And trigger the fire alarm. So 2, 3, 4, 5. your friend. Number one, we are not keeping anybody there. We'll be dead. Number 11. And this is teaching a mother of a preschooler about safety issues. Which of the following is the most important the nurse should include? When you're taking the test and they give you buzzword like preschool, age of the person, and all those things, pay attention to that. Unless it's a prioritization question, yeah, don't worry about it. But if it's in the stem of the question, there's a reason why I did not put the toddler. I put what? Preschool. Or, oh no, toddler and preschool are in the same group. Or adolescents or anybody. Yeah. So there's a reason why I put the preschool there, which also they are in the same group as the toddler group. What is the biggest problem with these people? Okay, what is the biggest problem? Right? They don't bully people. Okay, these are the school age people who do that. Substance abuse is what? Adolescents. Okay, choking, that's their big problem. They put everything in their mouth. Toddlers in preschool, their mouth is their friend. Anything they take is going into their mouth. So they're going to be choking and poisoning. That's why they have poison issue and choking. Sports injury is usually school age group. So therefore, it's better to teach the mother about choking. That's what the question is asking you. Number 12. The 85-year-old female, there's a reason why I give you, is admitted for pneumonia. Which of the following is the best action the nurse should take to prevent fall? Older patient is sick, and we want to prevent fall. You see what I did? Buzzwords. I rewrite a question. 85-year-old older patient who is sick. I need to prevent fall. Okay. Place client near what? Nurse's station. Okay. Keep bed in the lowest position. Okay. Orient the client to the room and call light. Okay. Instruct client to use call light when getting out of bed. All of them are excellent. But which one is the best? Okay. If they don't know where the call light is, if they don't know anything in the room, they're going to fall. So placing them in the nursing station and they know their room or where the light is, you can put the bed in the lowest position, but they don't know where to call the call light is located. Yeah. How can they use the call light if they don't know? You see what I did? Just using one answer choice and using it to knock other ones down. Therefore, this is the boy, number 3. That's the way you should be thinking when you're answering questions like that. Test taking strategy. Which phone call the nurse should return first? Okay, I told you when there's a prioritization, age is not a factor. But for this one, it may apply. A nurse is reviewing phone call from the peds clinic. Okay, peds clinic, yeah, is very important. Age, what they can do. A toddler mother have all the household cleaners stored in the upper cabinet. Yes, because their problem is poison and choking. 12-year-old is not allowed in the front seat. Yes, until you're 13 years old, you don't go there. 12 months ride in the forward facing. No, you remain in what? Rear facing until you're 2 years old. This one, I don't like it. 9-year-old is mad for riding in the booster. Yes, you stay on it till you are about 12 years old, 4 to 12 years old. So enjoy the booster. Number 3 is your one that the nurse should call first and say, yeah, it can be in forward facing right now. No, number 14. A nurse overheard another nurse saying bad words to a client. What is the nurse best action? This is the way I see this question. When you hear the nurse, saying bad things about a client, if it's illegal, you got to report it, right? If there is a safety issue, intervene. I don't see any safety issue. It's an illegal for you to do that. You are doing what? You are assaulting the client, verbal assault, right? Therefore, I need to report this to what? To the charge nurse. It's an illegal problem. There's no safety issue right now. So confronting them is not good. Filing incident report is not going to help the situation. Reporting to another nurse, they will take it and gossip. So I need to inform the charge nurse. But if I see the safety problem is being violated, I got to intervene right there and tell the supervisor. Otherwise, the patient will get a harm. Number 15. And this is precepting a new graduate. Which of the following positions initiated by the new graduate need further teaching? Further teaching. That means the position is wrong. Supine position for client after lumbar puncture. A puncture in your back, you should lay pressure in there to prevent leakage. So this is good. Supine for a client after cardiac catheterization. Yeah, they need to lay flat for at least 6 hours. Supine position for a client with head-to-toe assessment. There's nobody who does head-to-toe assessment with the client in what? High Fowler position. So this you don't need to intervene. There's taking strategy 1, 2, 3 already eliminated. I got to pick this. After liver biopsy, you're going to lay on your right side. That's where the liver is located. Therefore, this one need further teaching. Number 4 is your right answer. Number 16. And this is teaching new graduate about high risk areas for pressure injury. Which of the following location the nurse should include, basically? So which one? High risk area. Your heel is the biggest place, followed by the coccyx, scapula, elbow, and back of your head. These are all pressure injury areas you should worry about. And all of the answers are right. It's just a concept to give you which areas you should worry about for pressure injury. Number 17. Which of the following position will improve the client oxygenation? And this is caring for a client with what? Severe ARDS due to COVID infection. Client is intubated and receiving what? Maximum ventilatory support system with poor saturation. Which of the following position will improve client oxygenation? Rewrite it. All I'm saying is you have ARDS, poor oxygenation. You see what I did? Just the buzzword. Which position will improve your oxygenation? Supine is going to make you worse. Left lateral may improve it, but it's not the best. High Fowler is going to kill them. What you need is a prone position. The lung is all destroyed, and that is what they're going to use. Prone position. That's what happened in COVID. Everybody go prone. Number 18. And this is caring for a client with what? Severe ARDS due to what? COVID infection. Client is undergoing what? Proning 8 hours a day. Which of the following is a priority? Rewrite it. ARDS, you're undergoing proning. What is the priority? If your face is down, okay, and there's a tube coming out from your mouth, the most priority is dislodgement. Damage your eyes, nobody cared that much, but we worry about it. It's one we have to check for that. Pressure injury to your face, we have to check about it. Breakthrough presses because of your hand, we have to check about it. If the tube come out, you're dead. So which one is the priority? Tube dislodgement is the priority. That's prioritization for you, 101. Number 19. Which statement by the graduate indicate correct understanding of the dorsal recombinant position? A bunch of words. Test taking strategy. Look at what I'm going to do. And next is teaching new graduate position. Which one indicate correct understanding? Rewrite it. Dorsal means your back. Okay, recombinant, look at it. Something is bent. Okay, so I look at it, I say, laying on the back. I see back here. I see back here. Side, you gone. Side, you gone. I don't see bent. This is straight. Therefore, this is bent. Right answer. Adapt NCLEX way. That's how you break down question. Dorsal means your back. Ventral, your front. Recombinant, I see bent. And I'm looking for bent. These but this one doesn't have back. So I already eliminated. Now I have 50-50. The knee is straight. This is bent. So you lay on your back with your knee bent. It's like supine, but you raise your leg up and bend at the knee 90 degrees. Number 20 is a select or apply. And next places the client on the left side. So lay on the left side. The right knee and the hip are flexed. So they are flexed, okay? They flex like that. Lay on that side and flexed. And the hip and the knee extended. So extended like that. This flex and extended. That means you lay on your left side with your knee, hip flex, and the leg, hip, and knee extended. Which of the following procedure the position is commonly used for? Liver biopsy, you usually in your back, just supine. Vaginal exams, it can be in usually recombinant, dorsal recombinant, or low autonomy position, right? Paracentesis, you're sitting up. Therefore, enema. This is almost like the same position. That's what I'm trying to describe. So if you can see, it's a little bit difficult, but that's same position. A nurse is caring for a client with what? ICP of 23, too high. Which position the nurse should place the client? Concept, concept, concept. As you can see, all the questions I've been giving is concept. What position should you place this client? You know, 15 is too low, 50 too high, 45 too high, 30 is the best position to pick somebody who had a brain injury. Always 30 is better than any position. Which of the following order is accurate? And you graduate assess a client abdominal exams. This question you see multiple times. They love it because it's a concept. And report it to the precepting nurse. Which of the following order is accurate? Like I said, stop the video, answer it, then listen to what I'm going to say. How do you examine somebody's abdomen, and how do you report it? There's nobody before you examine the patient. Like I told you earlier on the question, you got to be what? Supine. Which one starts with supine? Test taking strategy? No, it's taking. After supine, I got to look. Which one am I looking? Inspect. I'm not percussing. I'm done. I'm picking my answer and moving on. That's my answer. You put the patient flat, look, listen, percuss, and palpate. Easy as be. Adapt and increase weight. Number 23. What is the next best action? A nurse is caring for a client admitted for what? Pneumonia. Client began yelling at the nurse and shouting at the top of the corner of the voice. What is your next best action? Once again, admitted for infection, now he's yelling and shouting at the top of the voice to the nurse. He's being violent. What is your priority? Safety. Maintain calm demeanor is fine. Use non-threatening voice to calm the client down. It's okay. It may not calm down. Calling security is the worst one. Keep a safe distance with the clear path, and safety from the client is your best choice. This is fine, but this, my safety is number one. I care about that. So remember, you got to go back. So stay away, tell him that you're going to come back when he's come down. Then you can continue your care. You can't ignore him. And this is to obtain a urine culture. Client as a Foley in place. Which of the following action indicate correct understanding of the specimen collection? I've underlined them. Urine culture in the patient as a Foley, what shows I understand it? If this is the Foley bag, okay, and this is the catheter, there's a balloon here. There's ports. We have ports here, okay, and you have urine here. You don't draw culture from here. You don't take this off. You go to the port, the side port, you clean it, and you insert the needle and you pull it from here by clamping here. So nurse collect the specimen from the drainage bag, negative. Next, remove the drainage bag and collect the specimen from the tubing itself. Negative. Next, collect specimen from the collection pot. Yeah, this one. Good. Next, remove the drainage bag and pour the urine from the bag. No, you don't do that. So the right answer is your number 3. It's no brainer, right? Straightforward question. Number 25. After teaching a new graduate on the principles of nasoenteric tube insertion for feeding, which of the following action need further teaching? All I'm saying is, if you placing, look at the word nasoenteric. This is no NG tube. Nasogastric tube is different. It's not the same. Nasoenteric tube always has a wire in it. We call it stylet. Okay, that will guide the tip of the tube to where you want it to. It has a lead there that take it down. When you insert it, you wait until you get an X-ray, and if you have good confirmation of position, you put a wire. If not, you advance it. If the wire come out, you cannot advance it anymore. So what did he do that indicate further teaching is needed? Advancement stop during coughing. Yeah, when the patient you injecting and he cough, just stop. When you finish, advance the thing. So that's good. Stylet remove followed by X-ray. Yeah, you can do that. See, you should not remove the stylet, okay, followed by the X-ray. A new tube placed with more position confirmed by X-ray when the stylet was out. When the stylet was out and we get an X-ray, that shows that more position, we place a new tube. We do not push the other tube in. Tube marking at the tip of the nose. That means you're marking it at the nose so that you can know the length. So the only one that needs further teaching is removing the stylet before X-ray. Client is in airborne precaution, needs chest X-ray. So we have a client in airborne, need a chest X-ray. Which of the following indicate correct understanding of the isolation precaution principle? If you are airborne precaution and you live in, okay, this principle, you don't wear N95, negative, right? You don't wear gown and gloves. You wear surgical mask. Client does not wear N95 and gown. So all you wear is surgical mask when he come out from his room. That's all. You see, just a straightforward question. It's the same thing. A client in droplet precaution need X-ray. The client has a surgical mask on. You're already wearing a surgical mask. Which of the following indicate correct understanding by the accompanying nurse? So you, the nurse, going with them. Client is already wearing surgical mask. You, the nurse, what are you going to wear? You wear nothing. So far as the patient is wearing mask and is out of his room, you, the nurse, does not wear anything. It's like somebody who has a droplet infection, has masks on, is walking on the street and you passing by. Do you wear something? No. So the nurse does not need to wear anything. So nurse wears surgical mask, no. N95, no. This all you do, nothing. When the patient is wearing a mask and you're going to get X-rays out of his room. So 4 is your right answer. Number 28. A nurse has one private room on the ward. Which client should be placed in that room? One private room. That means which of these guys need isolation? Private room. Private room. Okay? Private room. That means he has something that is going to get somebody infected or no. So which client should be placed in that private room? Client with viral meningitis is a standard precaution. HIV patient with CD4 count of 250 is a normal person, standard precaution. West Nile virus, standard precaution. ESB is contact precaution. So that one needs to be in isolation precaution. we give that room to that person. Number 30. And next, completed teaching a new graduate on isolation precaution. The new graduate wear what? A surgical mask, 1, gloves, gown, goggles, and face shield to change the dressing on the client in the private room for which of the following situation? A bunch of words. And nurse is wearing surgical mask. Which situation does he wear surgical mask? Gloves, gown, goggles, and face shield when changing dressing. Which patient do you think it is? Smallpox? So it should be smallpox. What do you think? The nurse has to wear N95. So this one is eliminated. MRSA, right? Drainage wound. Yeah, you wear contact staff, but you don't wear surgical mask. Because you're touching the wound, yeah, face shield to protect you, no surgical mask. This is a droplet, so you wear surgical mask. This is a contact, no surgical mask. So this is the problem. The reason why they have goggles, gown, and gloves is because they're changing the dressing, which become contact. So you have droplets and contact precaution together. So, and then you put it together and you find which one satisfies that requirement. Number 30. A nurse places an 18-gauge IV in the antecubital vein for IV fluid resuscitation. As the nurse attempts to infuse the ordered normal saline, the client felt impending doom and gasping for air. What is the next best action? Straightforward. You put an IV in. As you're about to infuse, the patient is like having airway issue. What do you think? This is air embolism. What is your priority? You put a mask on, you call a doctor, you clamp the tube, or you place them on the left side, head down. Any of this, that does not prevent excessive ongoing poisoning by air is wrong answer. You can put it on the left side, head down all the time, or anytime you want, but air is still rushing it. You put them on N95, you have it. You're calling the doctor, you're just killing them. If you climb the catheter, there's no more air going in, right? Put the oxygen on, place them on the left side, and you'll be done. Or place them on the left side, head down, put the oxygen on, and call the doctor. How about that? But we have to stop the damage by clamping first. 31. A nurse is caring for a client who need what? Kidney biopsy to rule out malignancy. Which of the following actions by the nurse indicate correct understanding for the procedure? Concept here. Kidney bleed like hell. Therefore, I got to prevent bleeding after and before. Client on the left side after the procedure. No, the kidney is on your back. Okay, if I biopsy it, I want you to lay supine. This one, it does not indicate correct understanding. Blood pressure is tightly controlled before the procedure. Yeah, if your blood pressure is too high, we're not going to do the procedure. Aspirin held 7 days before the procedure. Aspirin causes bleeding for 7 days because it affects platelet for 7 days. Excellent. Urine output closely monitored post-procedure. If your urine output drops after the procedure, it means you're bleeding, and that's a B-sharp moment. Assess mental status after the procedure. If your mental status changes after the procedure, you're bleeding. Therefore, we assess it. The 2 to 5 is your best answers. Adapt NCLEX way. Number 32. The client sustains superficial burn to the left, upper, and lower extremities, partial thickness to the front and back of the entire torso, and full thickness to the entire right leg. Client weight 220 pounds. Using the Parkland formula, calculate the fluid rate the client will need the last 16 hours. Make it easy. Just draw caricature, okay? It says superficial burn to the left. This is your left, this is your right. Left, upper, and lower. Don't worry about it. We don't count superficial, so that one is 0. Partial thickness to the front and back, so front. So 18 and 18, front and back of your torso, and full thickness to the entire right leg. So this is 9 and 9. Okay, 9 front, 9 back. Therefore, to calculate the Parkland formula, we need what? 4. We got to use 4 times the weight in kilos and total body surface area. So you have 18 plus 18 plus 18. Okay, so that's the 54. This is the 54 body surface area. The client weigh what? 220 pounds. If you divide, you get 100 kilos. So this will be times 100 over 54, basically. And these times, this will give you what? 21600 ml. This is the fluid that you're going to get. But they're asking you 16 hours. So you divide this first 8 and 16 hours, you divide the fluid into 2. So when you divide this by 2, you get 10,800 ml. So 10,800 ml for 8 hours, 10,800 ml for 16 hours. This is asking you the fluid rate in 16 hours divided by 16. When you divide it, you get 675. This is the portion they're asking you. So basically, you calculate the total for 24 hours divided between 8 and 16 hours, and you take the half of it and divide it by 16 will give you the fluid rate. If you need more of this, check Adapting class. I have good videos on that. You join our membership, you get all this. So all these contents, this is like a breeze. You breeze through this with a bunch of questions how to make you comfortable. So join the membership. It's free. I mean, it's cheap, $9.99, and you'll be golden. Okay. Number 33. A nurse is caring for a 4-month-old receiving what? Mechanical intubation for respiratory distress. Age here is becoming important. Which of the following findings indicate need for suctioning? So I have a 4-month-old intubated. What tells me that they need suctioning? This is normal for a kid who is 4-month-old. Respiratory of 35 is normal. Nasal flaring is not normal. Adventitious breath sound, it means anything that is abnormal. Crackles, bronchi, wheezing, all of them. Saturation of 95 is normal. So which one indicate is 3 and 4? Indicate that suction is needed. Normal 34. A nurse is observing 4 mothers administer oral liquid medication to their 4-month-old child after providing teaching. Which mother action indicate correct understanding of the teaching? This question is asking you if you understand how to give oral liquid to the mother. There's a reason why. What is the complication? Aspiration. So medication at the back of the throat using a droplet is not good. It's going to aspirate. Medication mixed with baby formula, we don't want that. Medication under the tongue is not a good idea either. The best is give it through the cheek. On the cheek, through the dropper, and the baby can swallow easily. So 4 is the best way to give liquid towards the cheek, at the back of the cheek, okay? Number 35. A nurse is receiving report on 5 clients. Which client situation should the nurse consider as a risk for fall? So which of this will tell you I'm risk for falling? That's all. Simple, straightforward question. If you use cane, yeah, assisted device, you are in trouble. If you are recent fall, you are number 1. Lancino period side effect, it does not include, even though it causes lower your blood pressure, it does not cause orthostatic hypertension. If you have a bunch of tubes, NG tube, Foley, surgical drain, yeah, it will trip you down. If you're delirious, yeah. So 1, 2, 4, and delirium are your right answer. 3 is not included. 4 lecture. If you don't understand, watch the 4 lectures on adaptant class. It's under fundamental. You find it in the one of the best review done on NCLEX. I got them NCLEX challenge, the 7 days challenge. You need to watch those videos. You never lack anything. And next is reviewing an order which says infused hypotonic solution X at F50 ml per hour. Which of the following solution the nurse should suspect the physicians will order? Select or apply. This is a question to trick you, right? Which of these, all I'm saying is, you rewrite this question. Which of this is hypotonic solution? Isotonic, hypertonic, hypertonic. One answer, isotonic. This is the only hypotonic solution in the system. It said hypotonic. So give you 3 is the only, there's only one answer there, even though I made it select or apply. Intentionally did that. Number 37. If you need fluid and electrolytes, I have a bunch of videos. A client sustained severe partial, thickness burn to 50% of the body surface area. Which of the following fluid the nurse should anticipate for resuscitation? Simple, straightforward. What fluid do you use for burn patient? Lactate ringer. No explanation. But there is explanation. If you give them a normal saline, because we give them large volume of fluid, they will develop acidosis. You don't want a burn patient to have extra acidosis than they already have. That's why we give them lactate ringer. We give them a certain bicarb and it's much better. That's the content. I'm a content guy. So a client has been taking atorvastatin in addition with test-taking strategy, as you can see demonstrating here, for 3 months. Which of the following lab value indicate therapeutic goal of the medication? If I give you statin, I want your cholesterol to be a certain number, right? I want your LDL to be a certain number. I want your HDL to be higher than a certain number. And I want triglyceride to be lower than a certain number. Which one is doing well? HDL is doing best. So that's indicate therapeutic goal. Number 39. And then submit the blood draw to the lab for what? Basic metabolic panel. Which of the following lab value the nurse should question? Select or apply. This is to teach you something if you don't know. BMP should not include LFTs, anything that has a liver function test. Albumin is part of liver function test. This is BMP, sodium is BMP, AST is a liver function test, and this is BMP. Therefore, which one should question? Call the lab. It said, I never order albumin. Call the lab and say, I did not order AST. So probably you give me somebody's blood. So that's the strategy for this question. Number 40. A nurse is caring for a client with what? Large umbilical caput medusa, spiral angioma on the chest. Buzzwords, pay attention. This can be a case. It's a case, but I just shorten it. Esophageal varices. You should be able to make a diagnosis based on those buzzwords. Umbilical, capital, medusa, spiral angioma, and esophageal varices. Client is admitted for hematemesis, is vomiting blood right now. Which of the following lab value is consistent with the disease process? You see, I just make fundamentals fun, right? Which lab value? All I'm saying is somebody have end-stage liver disease. What do you expect? In end-stage liver disease, albumin is going to be low because the liver make protein. There's no more protein. Platelet is going to be low because of portal hypertension. Bilirubin is going to be high because the liver cannot break it down. AST is supposed to be high because the liver is end-stage. ALT is supposed to be high because the liver is end-stage. Which one is consistent? It's 2 and 4. The rest are wrong. Albumin is not going to be high. Bilirubin is not going to be low. ALT is not going to be low. Number 41. And this is caring for 4 clients. Which client situation need immediate intervention? Which one we have to intervene? You're taking Coumadin on DVT, your INI is 2. Good luck, you're fine. Coumadin, this prioritization, break the thing into 2. Find the situation and what is you should worry about. And you have to be sharp when you look at each answer choice. Coumadin for PE, what do I spare your PT level? 25. Because you have normal is like 10 to like 13. So you multiply this by 1.5 and this by 2. You get 26 and this what? 15. We are at 25. We good. You have DVT and your PTT is 70. You're good. DVT on Enoxaparin and your platelet is less than 150,000. Yeah, you have low platelet, thrombocytopenia. We got to intervene. You're going to bleed. So 4 is your right answer. It's lab values you have to know. And this is caring for a client with what? Small bowel obstruction. There's obstruction. Client is complaining of what? Non-localized, diffuse, crampy abdominal pain. You got to learn how to use word in the question. Non-localized, diffuse, crampy abdominal pain. What kind of pain the client is describing? Somatic pain is localized. Therefore, I refuse it. If it's going to be neuropathic, I'll talk about nerve. This is talking about abdomen. It's going to be referred. It will go to a different place, okay, from where the pain is originating. Test taking strategy. This is a visceral, non-localized, diffuse, crampy abdominal pain. Excellent, right? Number 43. And this is assessing a 1-month-old newborn. Which of the following need to be reported to the physician? Something bad. Bulging Fentanyl when he cry, you see, if he's bulging already, that's a problem. But when you cry, you're good. Your heart rate is between 110 to like 160 and 180 when you cry. This is good. Respiratory rate is 30 to 60. You're good. Strong palmar grabs reflex, that's what you do. You grab everything. That's taking strategy. This has to be your answer. Types of air and the sacrum, the spina bifida derivative. So 5 is your right answer. There's only one answer choice there. Number 44. A nurse is receiving report on a 85-year-old female with dementia being admitted for pneumonia. Which of the following actions the nurse should include in the plan of care? Older patient has dementia, pneumonia, is being admitted. What do you think? I'm worried about safety, 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 safety. Assign room near the nursing station, okay. Keep what? Call light within reach, excellent. Keep belongings in the top cabinet near the door. No, they're going to fall. You go and try to pull it up. Belonging near them. Non-skid shoes and socks, okay. Bed in the highest position, they falling. So 1, 2, and 4, right answer. Safety. So write a topic down and match to them. You'll be fine. Select or apply. And next, has just provided teaching to a client with what? New prescription for Enoxaparin. Which of the following statement indicate further teaching is needed? That means if I give you Enoxaparin, if you say something wrong, yeah, I gotta intervene. I will call with black Tari's tool. Excellent, you bleeding. I will take Motrin for my knee pain. Further teaching should be needed because you're going to bleed. I will use razor blade for shaving to avoid bleeding. Negative, you're going to bleed more. I will increase my fiber and water intake, yes, to prevent constipation so that you don't bleed from your hemorrhoid. I will use regular toothbrush, no, Bristol toothbrush. So further teaching is indicated. 2, 3, and 5 are your friends that need further teaching. Straightforward, right? Number 46. A new graduate told a client that if you don't stay in the bed, I will tie you down. That's bad. Ethical problem. What ethical principle the new graduate has committed? Battery means you touch them. False imprisonment, you put in a place they don't want to be. Using your word, you assault them. Negligence, you do something bad and you know they did not meet standard of care. So this is assault. It's spoken words. Next question. This is a principle. And this is precepting a new graduate. Which of the following client situation the nurse should intervene? All of them are COPD. They have saturation 88. What is the biggest problem of a COPD? Never give them too much oxygen. Oxygen, too much oxygen, they don't like it. 15 liters is bad. 2, 3, 1, yeah. 15 liters of oxygen to a COPD, you're killing them. Never give them. You take away their drive. You take away their drive for breathing. If you give them too much oxygen, you blow out the CO2 and everything, they're not going to breathe anymore. So we got to intervene. Concept, I told you. This is our concept. Write everything down if you have a problem and go review it. And you don't have problem with fundamentals, because it's a lot of stuff. What is the next first action? A client with hemoglobin of 6 need blood transfusion. 10 minutes during the transfusion, clients report of what? Back pain, shortness of breath, and diaphoresis. What am I saying? I'm transfusing you with blood. All of a sudden, you have signs and symptoms of what? Reaction. Okay, transfusion reaction. What you do every time somebody is not responding the way you expect them to respond when you give them something, stop the poison. Checking vitals will not help them. Keep the IV line is not going to help them. Talking to the provider is not going to help them. Stopping the transfusion is going to be the best way. Stop the poison, the damage being done. 3 is your best answer. Number 40 now. A nurse is caring for 4 clients. Which client situation require the provider to be notified? Age here is a problem. Okay. A 2-week-old, heart rate of 110. Yeah, I don't like it. It's 110 to 160. So you're too low. 4-year-old, 4-month-old is fine. 9 and 6 months is fine. This guy, I don't like it. That's your right answer. Number 50. And this is suspecting a client with what? Vancomycin resistant infection, basically VRE, very resistant, right? Which of the following infection control precaution the nurse should implement? This is easy. Contact precaution. Which of this is contact? Place client in the private room. Excellent. Wear N95. You don't need a mask. Wear sterile gloves. You don't need the sterile gloves. Ensure single-use disposable equipment is possible. Yes. Use soap and water for hygiene. No, it's not C. diff. You can use hand sanitizers. In real life, this is okay. In your exams, this is wrong. When it's writing like that, use soap and water for hand hygiene. That means that's the only thing you can use. In your test, no, you can use both soap and water and hand sanitizer. So that one is wrong. But most people in real life will use soap and water. This is not real life. If they write it like that, don't pick it. Unless that's the only thing you can use. But there's more you can use. So 1 and 4 are right answers. Number 51. And this is assessing a client in the pre-assessment area before surgery. Which of the following require the surgeon to be notified immediately? That means you're doing intake exams for a surgery. Creatinine 1.1 is normal. Metformin, you need to stop it 48 hours. Patient stops taking aspirin 2 days. You need to wait 7 days. It's going to bleed. You drink 1 beer per week. It's not a problem. You say, okay, but this is more dangerous, right? Number 3, we got to stop in 7 days, at least. Number 52. A nurse is observing a client goes up the stairs using what? Crutches and right ankle fracture. So his right ankle is broken. Which of the following need further teaching? So that's the, whenever they give it to you, find which one is the bad side. Okay, find which one is the bad side. Client advance the good leg first. Yeah, if you go into the stair, good leg go up. Client places body weight on the crutches first initially, then lay down to the good side. Client advances the crutches with the good leg. The crutches is supporting the bad leg. So this technically is wrong. Number 3 is wrong. But look, number 4. Client advances crutches and the bad leg last. Basically, they move last. So that's the right one. 3 is wrong answer. You got to master crutches, wheelchair, cane, and everything, right? So let all apply. And this team is made up of RN, LPN, UAP, caring for a client who need blood transfusion. Which of the following actions are appropriate? UAP will pick the blood from the blood bank. There's nothing wrong with it. UAP and RN verify identity of the blood. No, you need the 2 nurses. UAP check vitals before the onset of transfusion. This is appropriate. RN prime the white tubing with LR. No, you prime it with normal saline. LPN monitor the transfusion after 50 minutes. Yes, so it's 135. Is your right answer. 135 is your right answer. Number 54. There's need to transfuse blood to a client with a very critical hemoglobin level. An emergency released, pay attention. Emergency release blood was sent to the ward for transfusion. Which of the following blood group the nurse will transfuse? All I'm saying is you need blood, but we cannot wait. So we give you emergency released. Which blood you think will be released? There's a concept. When we transfusing, the antigen on the donor will react with the antibody of the recipient. The old people has no antigen, so there's no antigen to react with the antibody on the recipient. Therefore, that's why they are the universal donor. So whenever they said they're giving an emergency release blood, it's always O negative. So don't forget it. It's because of this donor, this thing. The antigen of the donor react with the antibody of the recipient. O blood does not have antigen to react with the antibody of the recipient. Right? That's why AB are universal recipient. They don't have anything to be written on. Okay, they don't have antibodies on their listing. So that is the way to remember it. Number 55. After orienting a new graduate to the med-surg unit, which of the following actions indicate correct understanding of the teaching? 0.1 ml solution was used for intradermal injection. That's what you need. IM injection with needle at 90 degrees. That's what you do. The Z-track is used for IM injection. That's what you do. Intradermal injection with the needle at 15 degrees. That's what you do. These are basic fundamentals. Vastus lateralis for kids younger, 6 months, yeah. With IM injection, that's what you do. All of them. The new graduate is doing great. Number 56. A nurse is observing a new graduate perform open tracheostomy suctioning in an adult. There's a reason why there's adult there. Which of the following action indicate need for further teaching? All I'm saying is you suctioning for trach in an adult. Which one tell me you're doing the right thing? Nurse wear sterile gloves. You don't need further teaching. Suction pressure set at 50 is too low. For adult, it's 100 to 120. For kid, it's 50 to 70. So this need further teaching. Client pre-oxygenated with oxygen, does not need. Suction apply less than 10 seconds, but wait, during insertion. You don't apply suction during insertion, even though the time is fine. Suction inserted until resistant, then retracted 1 centimeter before suction was applied. Yes, so that's fine. Number 5 is good. So the right answer is 2 and 4. This is, if you have questions, watch my videos on suction, or it's under fundamental section, and you will be fine. And next, or watch the 7-day challenge, it's a fundamental. And next receives an order for ANSEF, 8 milligram per kilo per day, orally to be divided equally 12 hours to a toddler who weigh 22 pounds. ANSEF is available in 100 milligram in 5 ml. How many ml should the nurse administer per dose? Run your answer to the nearest whole number. So this is a calculation question. So you prescribe dose, which is what? 8 milligram per kilo per day, and available is what? 100 ml, milligram per 5 ml. So my answer is going to be what? ml. So my prescribed 8 milligram per kilo, but I have what? 22 pounds, which is almost 10 kilos. So I put my 10 kilos here, and I put my day times my available, which is 5 ml over 100 milligram. That's all, right? So let's go here, cancel the kilogram, cancel kilogram, ml, cancel ml, and I have 40 ml over 10 day, which is equal to 4 ml over day. And it said it's divided into 2. Therefore, if 24 hours is 4 ml, 12 hours will be 2 ml. So that's what I will give. Divided dose, per dose, you get 2 ml. Number 58. And this is observing a new graduate flush a central line. This is a concept. Which of the following action indicate correct understanding of the procedure? When you have central venous central line, the only syringe you can use that will not destroy this is 10 ml. This is just a concept. There's no way. You have to know all the things I've said in this 58 question. You can see one single concept. That's the way you should master fundamental. Okay, 10 ml. So don't flush anything with 5 or 3 or 50. They will destroy the central venous catheter. 10 ml is the best way syringe to do that. The pressure that is applied. And this is observing a client with crutches. You see, keep on coming after teaching. Which of the following action indicate correct understanding of the use of crutches? Client transfer crutches to the hand of the affected side when sitting, yes, so that you can use the stronger side to push on the bed. So that's good. Client support weight on the hand grips, yeah. Client in tripod position when ambulating, excellent. Client move the crutches and affected leg first when going up the stairs. You move the good leg first. Good leg is what? The unaffected. You don't move crutches and affected leg when you move. So which of the following indicate correct understanding? 1, 2, 3. It's the right answer. Number 60. And let's provide teaching to a client about risks of chronic kidney disease. Which of the following the nurse should include in the teaching? Question: what is going to cause kidney problem? Hypertension, number 1. Obesity does not do anything. Diabetes always affected. High protein and not doing any exercise does not affect that. Don't extrapolate that. Not doing exercise will make you have hypertension and then kidney problem. No. We want direct relationship. Uncontrolled hypertension and diabetes are the major risk factor for chronic kidney disease. This is health promotion question. And this is caring for 4 clients. Which client situation is concerning? You have to be sharp. And what does that mean? Something that is going to kill the patient. Continuous bladder irrigation, I expect you to have spasm. If you have angina and you're taking nitroglyceride, I expect you to get a headache. If you take rifampin, I expect your urine to become orange red. That's taking strategy. I got to pick this. If you have strep infection, you're going to have tea-colored urine. But what is the problem? Now headache. That's hypertension. That you have fluid overloaded. That's really bad. You're going to get stroke. So that's encephalopathy. That's a priority in that situation. Whenever you have post-strep glomerulonephritis and you have headache, hypertension, that's a priority. Number 62, a nurse is caring for a client in an ICU receiving mechanical ventilator. The nurse heard a high pressure alarm from the client's room. Which situation, the client which is this will be which situation the nurse should expect? Which situation you should expect? Simple. High pressure alarm means there's a blockage. Low pressure alarm means there's a leak somewhere. So you're leaking air. It's not the system is disrupted. If there's a blockage, tube disconnection will not give you high pressure alarm. When you extubate yourself, there's no blockage. When there's air leak, there's no blockage. Tube, when you bite it, you get a high pressure alarm. Number 3 is your right answer. 63, a nurse smells alcohol on a fellow worker who is going to to medicate a client. Which action should the nurse take? A nurse smells alcohol on a fellow co-worker who is going to medicate a client. Which action should you take? You know you're supposed to report it to the supervisor, but he's going to medicate the client. Safety issue. If there's safety, you got to intervene first before you don't let her go and give the patient to the medication to the patient. Finally, incident report does not help. Confront them and say, hey, you're drunk. You can't give the patient the medication. You're going to cause harm to the patient, and let the supervisor know. Don't tell a federal one. Notify the supervisor later that I want to confront you because there's a safety issue here, right here, right there. Number 64. A nurse provides teaching to a new graduate about infection control principle. Which action should the nurse intervene? A VRE client in the private room, okay. Scabies, contact. As a dedicated equipment in the room, contact. Client with varicella wears N95 in the room. They should not wear anything. Parvovirus. B19 wears surgical mask when you go to, this is a Droplet. So if you're going to get a CT scan, you wear surgical mask. Clients with the varicella should not wear anything in his room. So 3, which of us should the nurse intervene? Number 3, we got to intervene. Number 65. A client presents to the emergency room with what? Ankle fracture. Nurse assessment reveal confused client with orientation to only place. A surgeon obtained a consent when the nurse was evaluating another client. Which action does the nurse take first? Once again, make it simple. Rewrite the question. These are 5 lines. Patient is confused. Should not be consented. The nurse left and the doctor come and consent the patient. What do? You don't cancel the surgery. It wasn't you who scheduled it. Verify the client's signature. Patient is confused. Notify your chain of command. Don't call the surgeon. Let the charge nurse take care of it. A nurse is caring for 4 clients in the emergency room who need surgery. Which of the following consent is valid? Who can consent? If you are adult, or you emancipated, or you are not confused. Client was given morphine, no medication before you get a consent. Client is oriented to person only, is confused. I'm a military guy, yeah, it's emancipated minor. You have alcohol level of 1.2. Oh my God, you like blown up. So yeah, 3 is valid. The rest is not valid. 67. A nurse is caring for 4 clients. Which of the following client assessment finding is very concerning? All of them have left-sided chest pain. Be sharp. Make the diagnosis and see whether the diagnosis is worrisome. Left-sided chest pain relieved by leaning forward. This is pericarditis. Left-sided chest pain when coughing. This may be pneumonia. Left-sided chest pain with palpation, costal vertebral chondritis, right? Left chest pain that is radiating to your jaw, you have MI. Therefore, 4 is bad. That's how you answer question in a depth NCLEX way, flawlessly. Check my website, my YouTube for more content like that. 68. And then it's placed what? Matters test. This is also concept. If you don't know, I'm giving it to you now. Matters test on 4 clients. 48 reading show induration greater than what? 15 millimeters. Which of the following client is considered positive? Greater than 5 millimeters is when you are what? Immunocompromised. Greater than 10 millimeters when you have high risk features. Greater than 50 millimeters if you are normal. IV drug user is 10 millimeters. This is immunocompromised. This is 5. This is 10. High risk patient. This is 10. Average patient should be this. 69. The nurse is teaching a new graduate about acceptable abbreviation. Which of the following documentation need further teaching? You have to know them. PRN is acceptable. QID is acceptable. HS is not because it may be half strength. Even though I can tell this is a night, every day is good. So it does need further teaching. Number 70. A nurse is caring for a client after what? Brain surgery, who is currently intubated. Which of the following the nurse should include in the plan of care? You're going to see a question like that. Brain surgery, ICP, all these things I've talked about is like classic board questions. So master them. If you don't write the topic down, try and go over it, okay? Keep head in the neutral position and at 30 degrees, yes. Suction every 2 hours. They don't need suction. Suction them as needed. Every time you suction them, you increase ICP. They'll trap you with this all the time. Ensure quiet environment, excellent. Dim the room light, excellent. You don't need to turn them every 2 hours. You turn them, you're going to cause problem. SCDs need to be there. They need to have sequential SCDs, otherwise they get DVT. So 6 is right. 1, 3, 4, and 6 are your right answer. Number 71. A nurse is caring for a client with what? Dysphagia, problem swallowing after massive stroke. Which of the following the nurse should include in the plan of care during feeding? Keyword, no aspiration. Avoid aspiration as much as possible, right? So keep the head out of bed, 90 degrees, okay, as much as possible. When they're trying to eat, when you keep it at 90 degrees when you're eating. They'll touch backward, no, forward. Allow time for swallowing, yes. Lay them down after feeding, no. Wait 30 minutes to an hour, 30 to 60 minutes. Monitor for signs of aspiration, yeah. So 1, 3, and 5 are your right answer. Number 72. A nurse is evaluating 4 clients in the family medicine clinic. Which client need consent from their parents? We already talked about this concept. When it comes to minors, they are minors, 15-year-old, they are minor. You got to be 18 to be an adult. It comes to STD, no consent. If you need inpatient for drug abuse, no consent. If you need oral contraception, no consent. Eye exams, yeah, you need your mommy. to be there. Number 4, the doctor will not do it until your mommy is there. 4 is your right answer. 73, the client was immediately intubated for respiratory distress. Which of the following will confirm? You see the word confirmation, the endotracheal tube placement. ET tube will tell you it's in, it does not confirm. Listen to breath sound, does not confirm. Radiographic, I can see picture with the tube passing the carina, yes. ABG does not. So 3 is your best answer choice. Normal 74. A client report ongoing leg cramps for 1 week. Client is taking medication for hypertension but cannot name the medication. Which of the following may explain the finding? Look at the answer choice. I never give you a lot of clue from the question, but look at the answer choice. Which lab work you think will cause leg cramp? Sodium is normal. Magnesium is normal. Potassium is low. Calcium is low. But what usually calcium low cause is statins, which are whatever. This is the one that causes crampy hyper. So I'll choose number 3. A nurse is caring for a client with serum potassium of what? 6 and peak T wave. What is the nurse priority? Look at it. Think about this question. Potassium is 6 and you have peak T wave on EKG. Whenever you see EKG changes, don't do anything until you stabilize the heart. So K-isolate will lower the potassium. Dialysis will lower it. All this will take time. Insulin will lower it, but I need to stabilize the heart. So I give them 1 gram of calcium gluconate to stabilize the heart, to prevent damage, more damage from happening. The EKG changes is your warning. Otherwise, you go to wide complex tachycardia. You don't want that. 76. A nurse is caring for a client with a sodium of 130. Which of the following the nurse should include in the plan of care? They don't give you anything. This question requires you to think critically. Bring your content. You have to master your content. If you need a place to master your content, Adapt class is your place. I'm not joking about it, and I'm not boasting, but you got to try it. Watch some of the videos. Maybe this video tell you, can attest to that. But sodium of 130, number 1 is seizure precaution. Therefore, everything is about seizures. All bed and air rails padded, yes. Oxygen and suction at bedside, yes. Recommend 0.9 normal saline, no way. Hyponatremia, sodium is already low. You want to give them something greater than 0.9, so 3% or 5%. Restrict free water, yeah. Don't give them more, anything that will decrease their sodium more. Or for bed rails up, yes. And then pillow on their head, yes. This is not a restraint. You're just doing seizure precaution. In rare cases, or for bed rails up are all restrained, but this patient is going to have seizure. There's no restraint yet. So 1, 2, 4, 5, and 6 are your right answer. Number 77. A nurse is caring for a client with serum calcium of what? 7.9. Which of the following the nurse should expect to find on assessment? Simple, straightforward. Low calcium, things are up. Everything is up. So I'm looking for things that show things are up. If your calcium is low, your symptoms will go up. Fentanyl, up. Constipation, sound like things going up. Depression, things going up. Pedal spasm, things going up. Twitching, things going up. So 1, 4, 5. You see what I did? I don't even read the whole thing. I'm looking for things going up. The sound of the answer choice tell me things are going up. That's the way I do this electrolyte thing. It's easy. You can memorize them. So direction is your friend. And nurse is caring for a client with end stage, what, colon cancer, or have what, 3 months to live. Client is refusing to eat. Which of the following family request is indicated? Keyword. If somebody is in end stage and is dying, okay, dying. Anorexia is normal. They don't want to feed a dead body. Therefore, if they don't want to eat, leave them alone. Don't put the NG tube in. Don't feed them every 4 hours. Let them allow client to eat when desired. No G tube. It's not indicated. Number 79. A terminal ill client wants to know about advance directive. Is advance something preparing ahead? Which of the following statement from the client is accurate? There's two types. There's power of attorney and a living will. A living will speaks for you. You don't need a surrogate to speak for you. Will make a living will. No. Power of attorney does not make decision what? Decision does not make decision for you starting today, not today, until you cannot make your own decision. Living will give specific instruction about your wishes. Yeah, it's a living will speaking for you. Power of attorney can be rescinded. So 3 is the accurate one. And number 80. A nurse is caring for a client with what? COPD, reporting of what? Dyspnea. Which teaching is best to help client dyspnea? Pay attention with words in the case. I've said so many times, like I love words, I play with words. COPD is dyspnea. It's not having secretion issue. If you have a secretion issue, there's 2 things you teach COPD patient. If you don't know, half cup, okay, or pursed lip. If they have dyspnea, oxygen problem, yeah, you let them do pursed lip. There's dyspnea. If they have what? Secretion problem, you let them cough out. This patient is having what? Dyspnea. Coughing out is not going to help them. It's pursed lip to prolong aspiration to allow exchange of oxygen. So what I will teach you is pursed lip, your breathing. Unless they have a coughing problem, they can't get rid of secretion of cough. The board love those 2 terms. The nurse is caring for a client with what? Cervical cancer, receiving radiation via internal radiation implant. Which of the following the nurse should include in a plan of care? Simple, straightforward. Somebody is getting radiation through an implant. This is deadly. You want the implant to stay in until they're done, then they go. But they cannot be exposed to anybody. So no visitors allowed is wrong. Look, absolutely normal. There shouldn't be no. Okay. They allow, but time with the patient is limited. No is wrong. Keep all used linen in the room. Yeah, until the patient lead is gone. Dosimeter badge for all staff provided so that you can know your exposure limit. Lead container and handler at bedside in case the lead fall off. Wear lead apron during care so that you protect yourself. So 2, 3, 4, and 5 by your right side. Number 82, almost done. And next, provide teaching to a client about getting yearly flu vaccine as soon as it is available. Which level of intervention is the nurse educating the client about? Guess what? Primary intervention is preventing the disease from happening. Secondary is we are screening you. There's no word screening here. Tertiary, you already have it and we're treating you. Quaternary, we don't want to cause any harm during treatment. We're telling them to get flu vaccine before they get sick. It's a primary. Straightforward. Number 83. A nurse is caring for client 36-hour postpartum. Client is complaining of frequent urine output. What is the nurse best response? When they get after birth, they have what? Postpartum diuresis. They mobilize all the water. So they're going to pee for the 1 to 3 days. They're going to pee a lot. You don't need urine culture. This is an expected postpartum. You don't need 24-hour urine. You don't need urine tract infection. You can see 1 and 4 saying the same thing. 3, you're doing something. It's not answering the question. This is an expected finding. Number 84. And then receive report on a client diagnosed with what? Thrombism. Do you know what it is? What should the nurse expect? This is concept, content. Nobody teach you if you know it. You just like, the answer will be screaming at you, pick me, pick me, pick me. Lead poison. That's thrombism. That's the diagnosis. So this is lead poison. And the last one, I know you know this. RN and LPN caring for a client. Which tag should the LPN question? Well, I call it MMR most. They monitor most, or they give most medication, monitor RN finding, they reinforce, they do stomach care, teaching, and then tube feed. They can obtain information about client surgical history. They can get data, but they cannot do what? Assessment, initial assessment. It's a word is initial. Monitor RN finding, they can do that. Provide stomach care, that. Heparin is high maintenance medication. They should not be doing it. So that's the one they should question. This is the end of it. 85, I yield. Fundamental questions. This is for the NCLEX world. My gift to you guys. Take care of yourself. Go through it multiple times. Write the topic down. Go over it. And you'll be golden. If you need more help, subscribe to Adapt NCLEX. Join our membership. You will learn a lot. It's an investment. It's like a token supporting the channel. It's nothing like you can find. The amount of content you get for such a price, it's like nothing. Like going to buy hamburger. Trust me, you pay over $600 for this kind of content. But hey, take care of yourself. Join my, subscribe to the channel, and be good. All the best of luck. Take care of yourself. Bye.